everyone. Welcome to the Globe Podcast. I am here today with a very exciting guest. I have Brad here. And for those of you who are just joining us, we are Tailored Marketing and we help health, wellness, and longevity businesses grow their practices through strategic marketing and sales strategies. So if you are interested, drop a comment below. And so, yes, I have Brad here from Veterinary Staffing Systems. And I would love if you would just kind of go ahead and give a little bit of an introduction to who you are.
So our VSS is Veterinary System Services. I'm the founder. I set it up in 2014. I spent 17 years in veterinary medicine, mostly on the management side. And I saw a number of problems that I couldn't fix from within the practice. So that's why I started this company. And it's just a professional services company that it's designed to do multiple services, thus the discombobulated name, but everybody knows us as VSS. And we started with temporary certified slash registered slash licensed technicians. And then we expanded to other doctors, assistants, client service representatives, that sort of thing. We also do consulting. I do consulting on staffing and inventory. I have a background on the inventory side. I helped start a buying group. I've helped dozens of practices, hundreds of veterinary professionals, and people outside the veterinary industry understand how to incorporate inventory into their business and do that well. And we also have the first medical grade laundry service that caters to veterinarians. So it's a broad array
all
of what
encompassing.
we provide. Yes, exactly.
Basically everything. So I'm sure then, like, just from your background, like you said, you had a long background kind of working in this industry before starting your company. Did you kind of just see like a need for all of these different things within the veterinary discipline kind of?
Yeah, I mean, we, as many veterinary practices have for years, struggled with staff. I was having a conversation with my boss. It was between Thanksgiving and Christmas of 2013. I remember it distinctly, but we couldn't find help, and we had people that were really burnt out. We were asking them to do more overtime, and it just really was not conducive to the situation that we were in. And so, yeah, that was when the idea hit me, and I was like, this is something I should do. And I looked around. There's a company that started in Denver in the mid 80s, and similar thing for human hospitals. They looked at what human hospitals needed. They professionalized it, mechanized it. And so I basically used that model, tailored it towards veterinarians and started there. And the idea is to make life better. I mean,
Yeah.
Veterinary medicine, we have a high turnover rate. People stay in the industry not very long compared to other professional industries. And we have one of the highest suicide rates. And there's a lot of pieces to veterinary medicine that are difficult. Everybody thinks it's just puppies and kittens, and it's not. And so being able to set up a system that provides a better avenue to support the people within the industry and the practices themselves.
Yeah, no, that totally makes sense. And yeah, that is kind of, I mean, from someone who's not in the industry, it is kind of surprising to hear that. What do you think maybe accounts for the high turnover rate and people not staying in the industry for as long as other professions?
Well, the big buzzwords right now are burnout and compassion fatigue. And I think those concepts individually and separately, also combined, contribute. Veterinary medicine, we're basically confined to the same principles and supplies and just capacity as human medicine, but we don't have insurance to supplement that. I mean, there are insurance companies out there, but it's not set up the same. And so, we're doing things on a shoestring budget. And the other piece that I tell people about, try to convey, is in human medicine, I did some work in human medicine. I trained as an EMT. I did helped with search and rescue, Colorado FEMA Task Force 1 for several years. So I understand the human side on a minor capacity, but
Yeah.
in human medicine, it's a little bit easier to disassociate because when people are in pain or they're struggling, they tend to get a little grumpy. And so,
Yeah.
when as an EMT you drop them off at the hospital, it's easier to kind of separate yourself from that situation. But in vet med, when an animal's been hit by a car and it's in pain and it's still licking your hand, like there's a
Yeah.
different level of compassion fatigue that just really develops with that. And you're very limited with what you can do in these animals' short lives. So, I think there's a number of compounding issues that make it difficult for somebody to find resilience within veterinary medicine.
Yeah, I mean that totally makes sense. I've never thought about it that way, honestly, because like yeah, like you were saying, humans, are not always easy to deal with. Like just, like that's the short answer to it. And animals, for the most part, I mean, they're a lot easier to deal with, and they're very compassionate and very like loving creatures, so you do feel that a lot more just like being a human. So it makes sense how it's harder to disassociate from that, especially like being someone who, like, I mean, I have a dog, like animals are great.
They really improve your lives a lot. I know my four-leggeds are, I have a two-legged son as well, but my four-leggeds are almost children, as close as they can be. And you definitely develop a lot of bonds there. And I certainly don't want to discredit or whatnot, folks in human medicine, because I
Of
know,
course.
uh, working with a lot of people in that side of the industry or that side of the world, they have similar slash same struggles, and their problems are just as big to them as our problems are to us. But there is a misnomer where I think a lot of people think that vet med is a lot simpler, and it's
Yeah.
really not. And it doesn't have the same money backing it, and so it definitely creates some issues within it.
Yeah, no, that totally makes sense. And so, with kind of what you were talking about with like the compassion fatigue, also burnout, a word that everyone is super familiar with, how do your services, and obviously each one of them probably kind of varies, but how do they kind of help with those different issues that veterinarians and people who work in veterinarian offices are facing?
So, the staff. mm, I mean, I'll start with the laundry. The laundry is simply taking a task off of people's plates. A lot of
Yeah.
veterinarians don't understand what their laundry means to them. They don't understand that that is a source of secondary infection. And there's a reason why human medicine has the standards and the, stringent guidelines that are associated with laundry. And so I think, just helping people understand that this is a chore, and if you can take it off of people's plates and get them to focus on other things, that's going to help practice in general. And so it is a medically grade clean, which is cleaner than what they can provide in house. And within that, it's still at a cost that is comparable, to what they would pay to do it in house. So there's a lot of benefit there. Inventory side and consulting side is like most consulting services. I tell my clients that if you follow proper guidelines of purchasing, you'll spend less, you'll stress less, and you'll run out less. And I feel like everybody always has moments where they're like, you know, uh, they have doubts about that, but it's a science, and if you follow the math, then it'll work out. It really does. And so I have a lot of client testimonials and a lot of people that were like, "Whoa, I didn't necessarily believe that, but now that I'm doing it this way, my life is much easier. I stress much less. I spend much less money, and run out much less." And then obviously the staffing, which is the biggest part of our business, is really
Yeah.
overtime is the major part that contributes to burnout and compassion fatigue. It contributes to turnover. And if we can take that off their plates, then that's big. And then on top of that, people don't understand, like, staffing companies have a bad reputation, but VSS is not built like most staffing companies. We're American Staffing Association members, but our costs are just underneath what overtime would cost at practice. So
Okay.
rather than spending this much money, you can spend this much money and get somebody in that's fresh, that is capable, that can supplement your staff and really be able to contribute on that end. And then for the professionals that are doing staffing for us, it's a way to go into practices. I tell them, if you show up on time, you're already a hero.
Yeah.
There's a lot of gratitude that comes with that. And so they can go into practices and they can perform the task that they know how to perform. And it contributes to the practice. It contributes to patient well-being, that sort of thing. And then they can kind of walk away. And so they don't have to carry as much of the, I don't know, work-life balance home and get stuck with that. And just there are people out there that succeed, just like with traveling nurses. There are people in veterinary medicine that do very well with being able to go from practice to practice to practice. It helps them.
Yeah.
So this is a system that just provides that opportunity for them.
Yeah, it's almost it's good for the practices, and then it's also good for the providers that are providing the staffing as well. For a lot of people, especially like if you want to travel, or if you want, like, if you are very adaptable and you like new environments, like and then obviously for the actual practices, they need that staff. And do you primarily do like actual veterinarians? Is it vet techs or like front desk staff, or does it kind of vary?
Primarily, it's actually credentialed vet technicians.
Okay.
So we do registered, licensed, or certified, depending on the state that we're operating in. And obviously, there's crossover, and that gets into minutia. But
Yeah.
that is that is the bread and butter. We do doctors. We have several doctors that are on staff, and many of them have done relief on their own. And as with many relievers, they discovered it sucks because taxes are higher. You're stuck on
Yeah.
liability. There's just a lot of reasons that for many people doing relief on their own is not conducive, but they're very good relievers. And so they have decided to come underneath the VSS umbrella because we guarantee payment. They're
Yeah.
making as as much money, in some cases slightly more, depending on taxes, and it's just a better situation because they don't have to mess with any of the, liability or any of the insurance or any of that. And we are one
Yeah.
of the few companies that provides 100% benefits to our full-time employees. So $0
That's
come out
awesome.
of our employees, full-time employees, paychecks towards their health insurance. We cover that 100%. On top of regular insurance, workers' comp, other benefits that are within that. I'm very proud of the fact that this is built around people and it's not built around staffing. And I think that just creates a different environment. It's still
Definitely.
translating for veterinary medicine. We have a lot of great clients, a lot of good corporate clients, but there's still some that are, they know is 1099, and so they can't quite wrap their brains around it. But that's what happens with new things, and hopefully more and more people will understand. This is a win-win-win. It's a win for the employee. It's a win for the client. We can operate within that slight little bit of margin and make this a successful business.
Yeah, no, that totally makes sense. And I feel like also too for the employees that you have at VSS, like it's such a benefit to not be on 1099 too, just like from a tax perspective. And then also like you said, if you're providing healthcare as well, I mean that is like it couldn't be better as someone who is working, like traveling around from place to place, because typically if you're in that situation, you're going to be a 1099 employee for sure.
Exactly. A lot of folks don't understand what healthcare means until they have to start paying it. And
Yeah.
because we offer it 100%, we're able to, handle that before taxes, and we can get more bang for our buck. And so our insurance for our employees is a step above what most people are used to. And we have, knock on wood, a lot of good long-term employees that have seen this
That's
value
awesome.
and have been with us for years, which is not like most staffing companies, but it's been great because, they
Yeah.
see that piece and they get all the benefits of doing relief work on their own, with all the benefits of doing it under the umbrella of a company.
Yeah, no, that's super, super cool. And right now, what states are you all in? I know Colorado, New Mexico, Massachusetts. Are there any others currently?
We're licensed Texas, Arizona, North Carolina. I think I'm forgetting one in there, but there's yeah, there's a it's a slow process for us because
Yeah.
we have to marry the staffing laws and the state's current Veterinary Practice Act, and or whatever that's called in whichever state we're dealing with. And so
Yeah.
setting up in each state requires a lot of time and money.
Yeah, I
It's
believe it.
not like human medicine in the sense that so much has been legislated that, most human medicine providers on the staffing side, it's pretty relegated. It's pretty
Yeah.
consistent between states. Whereas with vet med, in some states, they don't even care about credentialing with veterinary technicians, which still boggles my mind.
Wow. Yeah.
We wouldn't allow ourselves to go into a hospital that didn't employ registered nurses. So why would we
Yeah.
allow our four-legged pets to go into places that don't accredit, technicians? Like I just that one still boggles my mind. But each state is different in how they do it. The ones that do that. So some are certified, some are licensed, some are registered. And so it really does take a lot to be able to, set that up. The DVMs is fairly consistent. That's a lot closer to human medicine. And so that one's a lot easier in that respect. But again, we're trying to be diligent with all of it. And so, it takes some time to set up on each state.
Yeah, wow. I did not realize that either. So like I mean with human, like you were saying with human medicine, obviously everything's like pretty standard. Obviously like some things vary state to state, but it's not like that much. But I didn't realize that state to state everything varied so much from a veterinarian perspective. And like as I have been traveling in each state that we've been in, like if I have had to go to the veterinarian for my doctor, I have kind of like noticed differences with like different practices, but like you notice differences too with like just like doctors' offices too. So like I haven't noticed anything so significant where I've been like, oh, like like that's weird or different or whatever. But that is very interesting, I guess.
Yeah, I mean, the liabilities are can be quite drastic from state to
Yeah.
state, and so there's a lot of pieces within that just we have to dot a lot of I's, cross a lot of T's, and with each contracts as we get them set up, some of the corporations that we work with are nationwide, and so we've been able to set within that each state has variations, and we all
Yeah.
understand that. But when you're dealing with a single doctor practice, a startup, like we have a lot of clients that are, single doctor or startup, and, their issues are much different than the corporation's issues. And so we pride ourselves on being able to work with them. We're also one of the very few companies that can work with state government agencies because we have the proper licensing and registration. We can work with schools. We work with
That's cool.
shelters. When a shelter can afford your services, it really does help
Yeah.
because they have veterinary needs too. And so there's a lot of parts that we have to, we only get one system. And I think a lot of people expect you to be able to, no, I want this system catered to me. And it's like, I appreciate, but we have to be able to work with everyone with the same system to make sure that we're under the laws as they're written. And, I think that's a lot of the areas where the translation is different. And it's not like human medicine in that respect.
Yeah, no, that totally makes sense. That's cool. And so I'm so curious, like are there, because this is kind of a newer like industry to me, are there a lot of other businesses out there doing veterinary staffing, like anything kind of like the laundry services, all of it like I mean, I'm sure people are out there doing consulting, but like are there a lot of businesses doing this, or is it kind of something that is like nuanced, I guess?
It's very nuanced. Yeah,
Yeah.
there are a number of accredited, capable, amazing consultants. I often refer several people just because of the way that they're able to do niche sort of items. And again,
Yeah.
my end is really, in inventory, mostly some staffing consulting in there, but mostly with staffing, people just want the actual staff. And so that's where we
Yeah.
focus on that. There are accredited, amazing companies that do placement side of staffing and have been in vet med for quite some time. There are very few that do the temporary staffing model that we have and
Yeah.
do it legally. And then, unfortunately, as with all areas, there's some businesses out there that are, you know, we'll just say pressing the bounds of legality in
Yeah.
that sense, and they don't really set up good systems that protect the employee or protect the practice. So there's a gambit of
Yeah.
folks out there trying to do some of this, but we're the first ones that have tried to touch on multiple areas of a practice in a tangible sense. It's not like we're going in and consulting on laundry. We do the laundry. And not only do
Yeah.
we do it to a human medical grade. So it's really a step above. And, the clients that we have they love it because
Yeah.
it's just taking this thing off their plate. They know they're getting clean laundry. They just don't even have to think about this minuscule problem anymore. And so that's really the goal with some of these things. Same with staffing. I tell a lot of clients, yeah, you think about your problem as that one shift next week that you don't have covered. But the reality is the problem is all the shifts that you have coming up that aren't covered. And
Yeah.
if there is a tool that you have in your toolbox and it's not one size fits all in that sense, and you're going to not use it every time, or maybe you use it most of the time, whatever, having that freedom to have something come in, have another tool to use is beneficial in and of
Yeah.
itself. And we don't have any other fees. Like, one of the things we pride ourselves on, clients only pay for what they use. So
Yeah.
when we have a single doctor practice that only uses us once every 6 months, they love it because they only pay for what they use and they just don't have
Yeah.
to think about it. So it's definitely taken stress off their plate. And, we say all the time, relief the right way, because
Yeah.
that's what we're trying to provide.
That's awesome. That's super, super cool. And so, my final question, one of my favorite questions to kind of ask all of the guests that I have on, what are your goals over the next year or so? What are you kind of focused on as a business with business goals?
I've already spread myself out a lot in covering
Yeah.
different facets in different areas. And so I don't know, I guess in that sense, I would like to just get better at what we're doing. I certainly don't want to try and expand anymore right now. And I think, for us is finding folks in some of these areas that we don't have this great foothold in yet, and be able to um, grow in those areas and provide the same service in those areas, because it's had a lot of success here in Colorado, and where we've started up in other areas, people are seeing it, and but it's a slow start. And I think just where the economy and everything else is at, like if we can just help in that sense, that's what we'd like to do.
That's awesome. I love that. Well, I will include all of the links to everything VSS in the show notes. If you want to go ahead and give like the easiest way to find you, easiest way to get in contact with you, I'll also include that as well.
Yeah, I appreciate it. It's really helpthevet.com is the best way to reach out to us. And depending on what facet you're looking for, there's various links within there that will take you to the right person that can help. I have an amazing team of ladies around me that have done great work being able to help build this, and depending on which facet, a certain person will be able to help you as fast, if not quicker, getting to them. So definitely helpthevet.com, please. Thank you.
Okay, awesome. Yes, I will put that in the show notes. I really, really appreciate your time and you coming on and sharing everything about VSS with us. So thank you so much.
Oh, Taylor, thank you. I appreciate it very much.